All right, so now let's talk about the COVID vaccines. I think this is very important, and the question is that are the is the Biden administration distributing vaccines on their global platform, their pledges to give away all these vaccines uh, based on global health, or is it based on corruption and connections, or is it based on geopolitics? And what we're finding out is that it's the second two. It's corruption and connections, and then based on geopolicy. And so there's a couple articles. This one in Political, it's a sore spot why officials are raising questions about Biden's vaccine distributions. And a lot of the vaccines that the U.S. is giving out is through the COVAX program. That's the UN global program that they put together. So when I'm talking about COVAX throughout all the COVID stuff today, that's what it is. The first story that they bring up here is former governor Bill Richardson recently made a trip to Myanmar, where American journalist Danny Fenster was being held. After Richardson's trip, Fenster, who had been convicted of I think 11 years, was allowed to leave Myanmar with Richards. And then a few days later, the U.S. announced, and this is something that the Myanmar ruling military government had been pushing for, is that the U.S. would be donating some vaccines through the COVAX program to Myanmar. I covered this at the time on the show, that the donation of those vaccines, those were the Johnson and Johnson vaccines that were potentially contaminated, although were then shown to not be contaminated. And so they are now sending those to the border region between Myanmar and Thailand, and those will be administered through COVAX. So, that's just one example where it seems potentially the U.S. traded vaccines for a geopolitical win. Another one is when U.S. senators flew to Taiwan and on the tarmac announced 700, I think 50,000 vaccines would go to Taiwan, and this is at a time where not that Taiwan is like the wealthiest country in the world or anything like that, or that they shouldn't be able to have vaccine. I'm not saying the U.S. can't get vaccines to Taiwan, but there's plenty of countries around the world that you could look at and say, oh well, they have much lower vaccination rates, much larger health concerns, and all of that, and so it's questionable about why these vaccinations are going to Taiwan, and also being announced in the manner that they're being announced, meant to deepen ties between the U.S. and Taiwan, and also continue to upset China on the issue, and be a leverage issue between the U.S. and Taiwan. So the Biden administration, the way they're deciding who gets vaccinations is apparently a coordinated. Oh, and by the way, on the Taiwan ones, just to add to it, Taiwan had been requesting the vaccinations from the U.S. for a number of weeks before this, and that was something that was confirmed by Senator Tammy Duckworth, by the way. So the Biden administration's little committee set up to decide who gets the vaccines is between the State Department, USAID, and the National Security Council. The person from the USAID is Gail Smith. And so that name will come up later. I just wanted to point that out. And then again, for looking at the State Department, USAID, and the National Security Council, this is the agencies run by Antony Blinken, Samantha Power, and Jade Sullivan, respectively. These are definitely people who look to use American, what they would call soft power, things like giving away vaccines, to try to influence different decisions abroad. That this would be the kind of actions that they would undertake regularly and have in the past. They're big humanitarian interventionists. There's apparently big disagreements on where to send the vaccines. There's been no public information put out on how they're making these decisions. There are some reports that they have a formula or something like that, but no real evidence on that whatsoever of, they're putting out, well, we're looking at population and vaccination rate and where there's surges and everything like that. And, another couple of questions I have is sometimes they'll say like, oh, we're sending these vaccines to Vietnam because there's a surge of cases in Vietnam. Well, if you're sending the vaccines now and it's going to take a week or so to get everything set up, and then it takes a while for the vaccines to become effective, a couple months if you're giving away the 2-dose ones between the time you get your first shot and when you're considering fully vaccinated. And so it doesn't seem like that's necessarily, it's like a reactionary policy, especially when you look at the vaccines and their effectiveness fade over time. And so it seems like if you really want to make the most of them, you wouldn't be donating vaccines where there's surges, but rather where you're anticipating surges to come in the future. And as we see that COVID appears to be somewhat seasonal, maybe this is something that could be predicted, not with 100% accuracy, but again, it seems just giving it to a country in the middle of a peak, while good for PR, isn't necessarily good it doesn't seem to be logical, I guess. I'm not an expert on from a health standpoint. But again, if they put out the public information, how they're making these decisions, it could be helpful. Now, there are people within the administration who are very frustrated, saying that the White House is making these decisions. My guess what that means is that the National Security Council of the three agencies has the most influence on where these vaccines are being sent. And if it's a National Security Agency, National Security Council, if it is the NSC headed by Sullivan, then my guess is that they are, as I suspected, handing out these vaccines in order to try to build anti-China alliances and relationships throughout Southeast Asia and Africa in particular. So there are reports that Trump had a plan. I'm not sure if this is the case, but it hasn't come out. So I just wanted to point that out. It was mentioned in the article, and there are Trump officials claiming that, oh, we had a plan that's not being followed. Another thing I want to point out that's going on in all of this, and that's, I guess, what I have on the U.S. administration part and how they're giving away vaccines for geopolitical reasons, and the little bit of evidence we now have that is the case. Also want to point out that the COVAX program and how the Biden administration is using that. And so ideally, I think what COVAX would like is for everybody to just send we're going to give you 1 million vaccines of the Johnson & Johnson COVAX, distribute these where you most see fit and what you most see to work. But what the U.S. is doing is earmarking those vaccines. And so they're saying these vaccines either need to go like Latin America or they need to go to Trinidad and Tobago specifically. And then that, is creating some problems for COVAX. And so let's say you're a country and you make a request for vaccines. Well, you need the vaccines right then. But if the U.S. gives it in 3 months, then you might not have the system set up in place immediately to handle the vaccine distribution. We'll talk about in a minute how that's leading to some vaccines being wasted. But now I want to get into the lobbying and the corruption going on for how people are getting their hands on the vaccines. And this isn't something that I necessarily suspected, but I'll explain what's going on here, and I don't think anybody who listens to my show is going to be surprised. So the U.S. specifically, but world wealthy countries, Israel, I think, has contracted with Pfizer to get enough boosters to have 5 doses for people. The U.S. has bought up not only the millions of shots the hundreds of millions of shots that they need to have Americans fully vaccinated and boosted and everything like that, but they continue to buy more vaccines that they say they're going to donate to the rest of the world. The problem with this is that other countries are either too far at the back of the line then to buy their own vaccines, or global groups like COVID or poorer countries who it takes longer to put financing together for these vaccines now basically just have to rely on donations from the U.S. because the U.S. has already bought the doses. It's going to take them so long to get them. the better route for all these countries, rather than trying to buy vaccines from Pfizer, Moderna, AstraZeneca, or from China, the Sinovats, or Russia, whatever they call theirs, rather than trying to get any of those. They're trying to lobby the U.S. And so there's Rational 360, and that is run by a communications firm that includes Patrick Dorton, former special assistant to President Bill Clinton, and John Lockhart, Clinton's former press secretary. And, they're getting hundreds of thousands of dollars from hundreds of thousands of dollars from the Kenyan government. And then they were able to secure meetings with Gail Smith, who again is the U.S. AID representative on the 3-person council that the U.S. is using to decide who gets these vaccines, and also White House Chief of Staff Ron Klein. And we know from other reporting in the article that the White House is making a lot of decisions on who gets those vaccines. And after those meetings, it was announced that Kenya would get 880,000 doses of the vaccine. And so, this is a, straight up lobbying bribery effort now, where the Biden administration has used taxpayer dollars to secure all the vaccines. And if any foreign country wants those vaccines, they have to pay Democratic, former officials, well-connected people in Washington, D.C. to lobby members of Congress, who have influence to lobby directly the Biden administration. And that's, the way they're going to get their COVID vaccines. This isn't a policy of COVID eradication. It's a policy of corruption. It's a theft of money. You have countries like Ghana, Kurdistan, who has, thousands of people whose conditions are so bad in Kurdistan, they're fleeing to the border of Belarus to try to get into the EU. Trinidad and Tobago and Barbados are all known to, have had lobbying firms in order to try to, get themselves some COVID vaccines. This is horrific. This is, stealing not only taxpayer money of the American people. Of course, Pfizer and Moderna are getting rich off of this because the U.S. government is just buying all the vaccine doses. That's another part of it. Maybe if, once the U.S. buys up all of their doses, if these poorer countries are trying to get vaccine doses, maybe they can't spend as much. And so the price has to come down. But where the U.S. is buying them, I'm sure they're, just throwing all the money and shoveling it into the coffers at Moderna and Pfizer and Johnson and Johnson. Anyways, some of the other lobbying has happened by the Gebhardt Group Government Affairs, which former Representative Richard Gebhardt, I believe he's a Missouri representative, and Michael Schiffer, who's a professional staff member on the Foreign Relations Committee. And after some lobbying, they were able to get 2.5 million vaccine doses sent to Taiwan. We're not, we don't have all the details here yet. I'm not saying that every single vaccine dose that's sent abroad is happening because of a lobbying effort, but this does seem to be the game plan for a lot of countries. And it's just created such a horrific corruption case for the global vaccine distribution. One more group to point out, and that is The Group, and it's The Group is all one word and group is all capitalized. The Group DC is another group that has taken hundreds of thousands from Barbados and Trinidad to lobby for vaccines. And then a potential conflict of interest, of course, is that all these companies are making the money on both ends, not all these lobbying firms are making money on both ends, because they also represent AstraZeneca, Pfizer, Moderna, and all these drug companies. And so, they're taking money from Trinidad and Tobago, this poor country, right, when they also represent Moderna, and lobby for it anyways, because it's good for Moderna for the U.S. government to buy all these vaccines from them. Absolutely absurd. Now, the global vaccine distribution, as I was pointing out before, is creating a lot of problems in countries. One example is Nigeria, where they received earmarked vaccinations through the COVID program, or through the COVAX program, and now 1 million of those vaccines are going to expire. One of the things that they point out is that for a lot of the vaccines were set to expire from 4 to 6 weeks weeks within receiving them. And so it wasn't feasible for them to have the resources and the distribution methods to get these vaccines where they needed to go in the amount of time before they expired. Another issue they're having with that is for a long time there weren't any vaccines coming into all these African countries. Well, now they're saying they're having too many. There's only so much of a market, and I'm sure it's going to be for some of these countries that as more people get vaccinated and more people know that their neighbor's vaccinated and everything like that, maybe they're more likely to get vaccinated, especially for countries. A lot of times they're getting like AstraZeneca vaccinations, which aren't improved in the US, and some countries stopped using them because of blood clots, and they're getting Johnson & Johnson vaccinations that were potentially contaminated. And so these kind of stories, I'm sure, increase vaccine hesitancy in these countries. Also, some of the vaccine programs that the West has engaged in Africa in the past. I'm not going to get into too many details on the show, but that might be something I actually take the time to cover at some point in the show. But those kinds of skeptical programs, the U.S. fake vaccination program in Pakistan created a lot of vaccine hesitancy, even among for like polio vaccines or something like that. So there's a lot of reasons that people might not want to take the vaccine, at least right away, especially if only 3% of the country is fully vaccinated. My guess is more people who know their neighbors who are vaccinated, the more people who are willing to be vaccinated with a little bit of pressure. And so it's going to take, time for the demand in some of these countries to uptake, but if you're just sending vaccinations, they're going to go to waste. That's another reason why the market is going to solve this a lot better than like a government welfare program, which is essentially what the United States created, where it has all the vaccines and it distributes where they go. If it was based on market, especially these poorer countries wouldn't be buying a bunch of and governments aren't competent and everything like that, but ideally at least they would have a better idea on when their populations are going to be accepting vaccines. And it's going to be a big public scandal. They spend millions of dollars on vaccines and they all sit there and go to waste. And so governments I think would have more of a need to understand, the ability to understand the needs of their people and when they're going to demand the vaccines. All right. Now I want to talk about Zambia in particular. This is another African country, and all the examples in Zambia here, I don't know if all of them are true, and you can read some of this article with a grain of salt. They attribute a lot of the vaccine hesitancy in Zambia to like mere rumors and conspiracy theories, where I think there's been vaccine programs in the past in Africa that were abusive enough that it's not just a conspiracy theory that you might not want to take this. But there are some things going on, report this article, that are really important. The first is that Zambia got most of its vaccines through the COVAX program. And so there's all kind of requirements attached to the vaccines that come through this program. And another issue is, with the COVAX program is, you had to accept the terms for these vaccines. And so I think any country would rightfully want to have some kind of potential ability to seek reparations if the vaccines that were sent to their country caused harm. And this isn't even necessarily to say like 2 years from now we all find out that the COVID vaccine has some horrible side effect, but rather let's say substandard manufacturing or poor storage or something like that, they send a whole bunch of tainted vaccines to a country. I could understand why countries, especially when you're getting 5 different vaccines, that's going to take a little bit of time in negotiation to be able to have contracts with all those different vaccine companies on how this legally is going to be handled. So there's a lot going on here. And Zambia is another country that has gotten a lot of different kinds of vaccines. But they have an anecdotal thing here where they have a Johnson & Johnson vaccine distribution site set up. And these 4 people show up there after walking a few miles to get their vaccine. And the people working there say, well, it's very nice that you want the vaccine, but unfortunately, if there's not a 5th person to take the 5th inoculation, then we can't give it to you. because there's 5 inoculations in the viral and they had to use the entire viral. This is maybe the stupidest thing I've ever heard throughout the pandemic, and there's been, a lot of competition with that, I know. But the fact that you wouldn't use 80% of a vaccine, which, by the way, I think the UK estimates that they waste 10% of their vaccines. In France, one of their shots, I forget which one, I think they have a 15% waste. So the fact that you would be throwing away for these, one doses to give out 4 is absolutely absurd, but that's what they're saying is the situation right now in Zambia. Another issue is that, while they're donating the COVID vaccines, which is good, apparently the COVID vaccine distribution people have no fuel for their cars, no internet, and no money for cell phones. And so they can't, get information from people to give them a call in a couple weeks to remind them to take the second dose of their vaccine. And so there was an example where 848 people got vaccinated, and then only I think 140 or something came back for their second shot. And, as data has come out, only getting one shot of the mRNA vaccines is not a very good long-term preventative for COVID, even by, the data the CDC and these companies put out, if you want to take them at their word. And so that's that's a lot of the problems going on, that they can't bring the vaccines to people in Zambia. I guess you gotta walk a few miles to get the vaccination, and if you walk a few miles to get the vaccination one day and they turn you around because you only have 4 people in your party and you need 5, well then you're probably not going to go again. And that's what one woman describes happened with her husband. He showed up a couple times and they didn't do it. They also say they're not doing a very good job of using the existing infrastructure that exists in the methods with cholera and malaria, HIV, tuberculosis, which are all, I think, bigger killers and bigger problems according to the people interviewed in this New York Times article. And for the people of Zambia, they're more concerned about cholera, malaria, HIV, tuberculosis than they are COVID. And I don't think this is because of any misinformation or anything like that. I think those things are just bigger problems, right? There is a degree of problems in the world, and sometimes COVID isn't the biggest one. Yeah, so that's particularly what's going on in Gambia and why vaccines are going to waste. And again, how inept this all is. You're telling me you have the ability to send 1 million vaccines to Zambia, but you can't figure out a way to get the government a little bit of money, or even if you gotta give them a lot to get a little bit of fuel so these people could drive around and hand out the COVID vaccines. It seems so absurd. Now, maybe more importantly than the failures to adequately distribute vaccines in Zambia and everything like that, especially because, as people point out, there's bigger problems in Zambia. One of the people interviewed called it vaccine indifferent. They're not scared of the COVID vaccine, but when you got everything else going on live, trying to feed your family, literally trying to feed your family, not in the American sense, you're going on vacation to Disney this year. No, the kids need to be able to eat, and if you don't work today, you don't get to bring home food. And with things like HIV, it's just not the most important part. But they say that some of the resources in Zambia that would typically be used to vaccinate young children when they initially come into young clinics are now being repurposed for COVID. And so if you're only vaccinating people with one vaccine, right? So it's not super effective anyways. A lot of these vaccines are going to waste. I know. I mean, I'm not an epidemiologist. I don't have the data yet, but I'm guessing that it's going to come out that more children are going to end up dying in Zambia because they didn't get their malaria vaccine, versus the number of old people in Zambia who deaths are going to be staved off by them not having more of these COVID vaccines, especially when, again, we're only talking about vaccinating a small percentage of the population anyways. I think they have a 7% vaccination rate, and they don't have lines at their COVID centers. centers or anything like that right now. And so, just so many of these vaccines are going to waste. So many more important problems are being dropped and legitimately deprioritized in favor of COVID, when COVID isn't the biggest problem all around the world. If you go back to this show in April of 2020, I'm talking about how one of my biggest concerns about the lockdowns isn't me losing my personal freedom, but the hysteria of wealthy Western countries about COVID was going to cause a repurpose of global aid and markets and everything, and it would end up costing a lot of lives among the poorest people in the world. And I think that prediction, unfortunately, we're starting to see the evidence of it panning out, but I definitely think it's the case, and I really do stand by it still. A couple other COVID stories I want to talk about here. I'm a libertarian. I don't care that people are rich. That I don't think that's like a huge problem. What I do think is a problem if you take a global pandemic, you shut down the world economy, and then the richest people get a hell of a lot richer. Right now, they estimate that billionaires collectively own 3.5% of the global household wealth. That's up from 2% at the start of the pandemic, so that's almost doubled. If you look at one of the industries right now that's absolutely booming, it's the super yacht market. The super yacht market, not just, a doctor who wants to buy a big boat. We're talking about executives at these companies taking their, hundreds of thousands of dollars that we're getting in bonuses and putting down, down payments on multi-million dollar yachts. That's where the money is going right now. And it's just absolutely disgusting. We need to be calling this out and yelling about it, because the effects down the road for the coming decades are going to be absolutely massive. And again, this isn't like me worried about like wealth inequality necessarily, but the fact that they have stolen our money. And just giving it to all their friends throughout all of this. They've taken the pandemic, and they made the biggest deal out of how they're all concerned about this and how everybody needs to be doing their part. Well, according to for the oligarchs of this country, doing their part is stealing our money, just mass billions of dollars of it. It's crazy. All right, I want to talk about the vaccine mandates in court. Towards the end of November, we had the Supreme Court Justice Stephen Breyer refusing to hear a case from employees of the Mass General Brigham Inc. hospital network that were suing against their hospital's vaccination mandate. It was declined to be heard by the Supreme Court. The Supreme Court has declined to hear similar cases where, it's people suing their employer in Maine, New York City, and Indiana University. And so this isn't necessarily surprising to me that, especially in the cases of like, somewhat private hospital groups or something like that they're not going to be forced or they're not going to be prohibited from forcing their employees to take the vaccine. I guess, from my standpoint, if a hospital really wants to claim we have 100% vaccination rate among our employees and wants to mandate that is something they could do. Although, if you want to claim like this meant our hospital was COVID free, that would be a problem, because you could have COVID even if you've been vaccinated. But I don't think the court decision was based off of that. Now, the government mandates to get vaccines have not been faring as well in court. First, at the end of November, we had two separate rulings from federal judges, one in Louisiana, which effectively blocked the vaccine mandate for health workers across the country, and at hospitals and other facilities that receive federal funding. And then the second ruling was by a Kentucky-based federal judge that paused the administration's vaccine mandate for federal contractors, but that was only for people in Kentucky, Ohio, and Tennessee. There was a second ruling on the federal healthcare mandate, and this was by a Missouri judge, and there was a lawsuit brought by attorney generals in 10 states: Alaska, Arkansas, Iowa, Kansas, Missouri, Nebraska, New Hampshire, North Dakota, South Dakota, and Wyoming. And then that judge blocked the federal healthcare mandate in those 10 states. So my understanding would be is that, let's say, you really want to make sure that grandma is in a a long-term care facility, and you want that facility to have a vaccine mandate, and that facility has a vaccine mandate and says, yep, on their door, we have a vaccine mandate. Then that could happen. However, the federal government cannot require that just because a healthcare facility takes Medicare, Medicaid, whatever dollars, that they have to then mandate all their employees take the vaccine. All right, I think we have, one more story here on a ruling, and that was from a federal judge in Georgia who temporarily halted Biden's vaccine administration mandate for federal contractors across the country. And so this is actually expanding on, not directly, but in effect expanding on the ruling from the Kentucky judge. I'm not surprised about the federal contractor mandate. I thought that was going to be in jeopardy after companies like Huntington Ingalls and Northrop Grumman, these defense contractors, were all putting up a big stink about it. These are people who have the most influence in our country. And if they don't want a policy to be in effect, I think they could potentially make that happen. So let's talk about COVID vaccination numbers. A couple stories here on the CDC. They are currently claiming that 99.9% of every person in the United States that's 95 and older has received at least one dose of the COVID vaccine, but this appears to actually not be the case. Their numbers actually say that more elderly people have been vaccinated than the number of elderly people that existed in the United States in 2019, And so the population may have ticked up. You also may have the effect of, you're measuring people 65 and older who got the vaccine. And so throughout, the past year where you've been able to take the vaccine, there have probably been people in that category who have died. Well, there's definitely people in the 65 and up category, a significant number that have died, but also more people moving into that category as well. And so if you have a lot, you probably have people in that margin too that are inflating these numbers a little bit. You have places in the world like the UK little colony territory of Gibraltar, which hangs off of the Spanish Peninsula there, and I think they actually have a positive vaccination rate because people, I think mostly from Spain, have gone there to get their vaccination. So they've actually given out for more adults that they have. And so another thing that could be inflating this number is if there are illegal, undocumented, whatever you want to call them, people in the United States who, got a COVID vaccine. Not in any way complaining about that. I'm just saying that could be fudging these numbers a little bit. But it seems that the biggest problem is that the CDC is just simply misreporting the numbers. It looks like, there are states where the CDC claims that the rate is 99.9%. But if you look at those own states' websites, it's, in the 80s. Also, this is backed up by the polling numbers where you have, let's see, I think they usually show like 89 to 80% of people in the 65 and up age group that have received at least one dose of the vaccine. So again, the CDC number is off by some 20%. Now, the concerning part about this is the CDC keeps saying we make all of our decisions based off of science and data, but if you're operating off of bad data, then that's going to almost necessarily give you bad results. And it's really concerning because we're not talking about them being off by a couple percentages here. We're talking about them being off by 10 to 20% on the number of people that they think are vaccinated versus those who actually are. All right. Let's see. We have Also want to talk about the this article from VOTS titled "The One Dose Problem is Real." Now, if you read this article, I'm not staying by the tone of this article, but they have some interesting numbers in here pointing out that there are currently 36 million Americans who, according to CDC numbers again, only have taken one dose of the COVID vaccine. And there should be a number of people who have, and these are of the 2-dose vaccines, not a Johnson and Johnson. That doesn't explain this disparity. I made sure that was the case. But there are 500,000 people on average a day who are taking the COVID vaccine. So if you look at that, you would expect there to be 14 million people who have only taken one dose. But, this is obviously 22 million people more. And so that's a lot of people who have only taken one dose of the vaccination. Now in here, they go through and they talk, to experts who are saying that, taking one dose of these vaccinations really isn't all that effective. And, they're saying that this is a real problem. I'm not sure so much it's a real problem, but I do think it suggests that there's, questionable data out there. If you had 22 million people who say maybe, and I'm not endorsing doing this, I'm not saying anybody should do it. Hell, one day I think it could potentially be, with the route we're going down, illegal to do this. However, I think maybe people have taken advantage of the, fact that if you go there and you get like a little card thingy, and then the second time you don't have to go there, you could just write it in. Again, not saying that 22 million people did that, but I suspect that may be the case. Now, if those people then get COVID, are they counted as vaccinated or unvaccinated? I think there's a lot of questions about that, and around, again, how accurate and how good all the data that the CDC is using to make decisions on how much, freedom we all get every day, which is really, concerning. The CEO of Pfizer said that a fourth vaccine shot could be needed sooner than he thought. Initially, they were saying 12 months after the third dose, but now they're saying that timeline needs to be moved up. Now, they're saying that this is because of Omicron, but it's not exactly clear to me that the new variant is in any way a need to get more vaccination. One day, according to Pfizer, that the vaccine works against the new variant, and the next day you have to get the vaccine sooner because it doesn't work against the new variant. Also, from the evidence coming out, there's nothing showing that this is any more deadly, likely to lead to a hospitalization than other variants. And so why this would expedite it seems to be a question mark. Now, he could just be trying to sell vaccines, but we also have South Korea now announcing that they were moving up the recommendation on when to get the third dose from 4 months to 3 months. So they're saying that you get, one, and then you get your second at 2 weeks after that, and then 3 months after that you get your booster shot, and that's what you need to be considered fully vaccinated. All right, a couple stories on the military here. The military is also looking at boosters, and I did just want to take a second to mention there also seems to be a pretty big gap in the military numbers on the number of people who are fully vaccinated versus the number of people who have just taken a single dose. The military says 96.4 have had at least one, but then only 74% are fully vaccinated. Now, some of these numbers may be the case that I think a lot of branches had their fully vaccinated. You had to have your second dose by the end of November. But, my guess is that you're not counted as fully vaccinated then until mid to late December. And so, that could account for some of the gap if people really waited for the last minute to take the vaccination. One interesting thing, though, that makes me suspect that this might not be the case is that the Army said that only 21% more of its soldiers got vaccinated after the U.S. made the decision to mandate vaccines in August. Now, they were touting this as a real win, but I don't know. If you only get 21% additional people taking the vaccine through the mandate, I don't know. All right. I want to mention that it seems the federal government will begin disciplining people for being unvaccinated next year. It looks like they're going to start off with, like, making you go to a doctor, or they're calling it counseling. My guess is that you're just talking to a doctor about it, and they're going to really try to get you and pressure you to take the vaccine. But at some point, they will start laying people off. This will also be true for the military. All right, last couple stories I have on COVID here. Amtrak says that they will have to cut services because of the vaccine mandate. They say 5% of their employees are not fully vaccinated, and this is going to cause them to have delays to their services. An additional problem that they have at Amtrak is they lack the leadership and staff to hire new and onboard new staff. And so it seems that this problem is only going to compound itself at Amtrak. Consequences of COVID have been some surprising. An increase in car crash deaths during the COVID pandemic. The number had been declining for a long time, but then in 2020 upticked 7% over 2019. And this was despite the fact that Americans were driving a hell of a lot less. In fact, if you look at the 2019 versus 2020 numbers and the amount of miles driven by Americans to get those traffic deaths, it was actually up 23%. In the first months of 2021, I think for 6 months of 2021, it's actually up 18%, even more significant. Now, initially, they had suggested that it was just, people on wide open roads or something like that, but it seems to be people engaging, intentionally in more dangerous behavior and more substance abuse problems. And so, we have more Americans dying because of the lockdowns on our roads. It's, just another example of the unintended consequences that you have when you lock down everybody in the country. We now have some reports from the U.S. government saying that the childhood mental health crisis is getting worse. Compared with 2019, emergency room visit attempts for suicide attempts rose 51% for adolescent girls in early 2021. Among boys, there was a 4% increase. Depression and anxiety doubled during the coronavirus pandemic, with 25% of youth experiencing depressive symptoms and 20% suffering anxiety symptoms. And it's just absolutely insane. And one of the things about the whole COVID pandemic that I couldn't believe from the start is how much we have prioritized the healthcare needs of the old among the healthcare needs of our children. We're also finding a massive increase in the number of suicide attempts from children. It was up 51%, or excuse me, those aren't the correct numbers. Suicide attempts for 5 to 8 year olds was up 47% in 2021 compared to 2016. Prior, in previous years, it was only increasing by 15% a year. And so this is a threefold increase in the amount of increase that they were experiencing in childhood suicide prior to the pandemic. We also have a 182% increase for the 9 to 12 age group. And then an overall 30% increase in hospitalizations for suicidal behavior and idealizations. And again, this was, I think, very predictable, and things I was saying very early on in 2020 on the show that would happen from the COVID lockdowns. Again, there could have been reasons for people to stay home. There could have been reasons for people to isolate. COVID has killed people. Not arguing with any of that stuff. But there are unintended consequences to making people wear masks all the time, including children, to, isolating children from their friends, forcing them into remote learning. All of these things are going to have consequences, and we're seeing a huge uptick in childhood mental health problems. And again, I think this is something that we have to weigh against continuing these lockdowns, although our government almost completely refuses to even acknowledge or try to do that. Let's see. Some of the money that is meant to go towards, improving COVID-19 ability to combat in schools, school districts are spending on vape detectors and tennis courts, which is just ridiculous. Nevada, the state of Nevada, will charge its state public employees an additional $55 a month if they are unvaccinated. This is really going to hit, of course, the lowest income workers who $55 a month is $600 or almost $700 a year. We're talking about, this is a substantial amount of money that you have to pay if you merely want to continue to, go on your business unvaccinated. We also have more National Guard being deployed to medical facilities throughout the United States. This seems to come as we're laying off more healthcare workers due to COVID mandates. It was dozens in both Maine and New Hampshire, and then New York deployed 120 to long-term care facilities.